The Sunyani Teaching Hospital, established in 2003, remains the main referral center for three distinctive administrative regions: Bono, Bono East, and the Ahafo region, providing medical care for over 3.8 million indigenes. The footage captures a number of existing crippling challenges, hampering the day-to-day service of the facility, making it difficult to meet the growing medical needs of the inhabitants presently.
So, Sunyani Teaching Hospital used to be the original hospital of the then Brown Ahafo region. So, we serve people from all the three neighboring regions, Bono East, Ahafo, and some part of Western North and Savannah regions. We have patients coming all over from those places to the hospital. So, the hospital used to be the regional hospital for Bono region until it was converted into a teaching hospital in November 2023. So since then we have been operating as a teaching hospital. So we lack most of the equipment that we will require to provide this specialist care. Some include MRI machines, mammogram machine, X-ray machines, endoscopy equipment, CM, dialysis machines, and even hospital beds. As a teaching hospital, we need a standard accident and emergency center. As we speak now, our A&E department has only 12 beds. And like I said, we are to provide advanced health care. However, from time to time, we get cases that should have been treated at the primary levels. So when we go to our family medicine center, the place is always choked with a lot of patients coming all over from the country. So it has brought about the need for a new family medicine block for the facility, so that patients can go there for their first treatment and be referred to the other specialized clinics for health care. And one other infrastructure requirement is the physio and rehabilitation center. If you get that one too, it is going to help us a lot. We know the government has come out with this primary health care policy, which is helping. And if we are able to streamline some of these things too, it can strengthen the facilities at the peripheral levels, and we can provide the best of care as a teaching hospital. When you bring a patient for emergency care and there's no bed or the complement of other resources to take care of them, it becomes a problem. It's a problem for all of us. So the hospital having only 12 beds for the emergency is woefully inadequate. So what we are doing is that we extend the emergency care to some of the wards. We also have one of our biggest challenges in the hospital is the lighting system, generators. In the event that we encounter any power outages, it becomes very difficult for us to operate. The machine that we are using is an old generator that cannot supply power to the entire hospital. So we are always found wanting when there's light out. So we getting new generators in the form of support will help.
This is our emergency facility, which is woefully inadequate, very small. As you can see, we only have a 12-bed capacity. Sometimes, if it becomes critical, we can push it to about 11-bed capacity. And as you can see, we have a lot of needs. We need a lot of things to make the emergency a real emergency situation. First about the capacity, and then in terms of instruments and equipment, monitors, cardiac monitors, proper beds, proper emergency beds, and then a whole lot of other things, AEDs, ventilators, and then ultrasound scans and whatnot. We have some, but no, woefully inadequate. As we are speaking to you, we have only one ventilator at the emergency because of the capacity. We have only one. We have one AED and then one FAT scan, which is not adequate. So anything that the office can do to help us, especially in terms of creating more capacity so that we can take in more patients.
If you look at each bed, you can see that some of the beds you can't prop them up well. You have to use, how do you call it, boxes. You have to keep boxes underneath. So in case you have a patient who needs to be propped up at an angle to help with the respiration, you have to put a box under it. So the bed in itself, even though we have 12 beds that we can wheel around, functionally you can't prop them up, so it's a little bit defective.
So as we all know, we have checked the CT scan that it's already working, and this is the first CT scan that was installed for us. But now it is not working, it's not functional. It has been broken down for years now, and so we have only one CT scan that is working for the entire teaching hospital.
Yes, here's the dialysis unit where we do the renal replacement therapy for people with chronic kidney disease, people whose kidneys are not able to function as a normal human being is supposed to do. Yes, so we have only 3 machines here. Some of the challenges that we have here is that there are a lot of patients here, but the machines are few. So this is making us unable to attend to many patients that we are supposed to, and sometimes electricity issues too is very, very bad. Sometimes patients may be on a machine, then lights go out. We have to wait for the ECG to do what they are supposed to do, or we have to call the maintenance so that they will do some preparations at the hospital, how do you call it, the plants, so that they get us power. It takes a lot of time and then a lot of resources. A lot of things go on in here, but we are urging all stakeholders to come to our aid.
I'm Patricia Alipi from Sunyani Teaching Hospital, and this is the labor ward. Yes, this is where we do our deliveries, both normal deliveries and then cesarean sections. So as Sunyani Teaching Hospital and as a maternity block, in fact, we can't do this alone with our power. So we will need some medical equipment, and we know that even as we are caring for these pregnant women, medical equipment come to play. Yes, so without this medical equipment, we can't give the best quality that this client deserve. So we will plead with the stakeholders to help us with this medical equipment. For instance, this is fetal Doppler that we use to check the well-being of the fetus in utero, and this one, as you see here, is the CTG machine. Yes, it also helps us to detect any deviation even as the client comes in labor. So without this machine too, we can't give our best as in monitoring the fetus. And this whole entire unit here, ideally every labor room should have one. But here lies the case, we are having only one that we are managing in all the labor suite.
Good afternoon. This is the obstetric theater. So starting, we have this suction machine. As you can see, we have a lot of attachment to it. We are supposed to have 2 bottles, but unfortunately we have only one, and it's not in a very good shape. So we will tell Honorable or any other person who can help us with it. So there is supposed to be a locker for anesthesists to store their drugs. Unfortunately, we don't have any. So they keep storing their drugs on the machine here. So we are pleading if we can get a beautiful small locker here for anesthesia to store and keep their drugs. Okay. And as you can see, this is not the ideal. You're supposed to have a long handle for the taps so that you can easily open and close for proper scrubbing and to prevent infection. And our soap dispenser here with a dryer. Unfortunately, we don't have it here. So we are pleading with such people to help us with it. Then we also have a standby operating lamp. It is not in good shape at all. Immediately the light goes off, it also goes off. It's supposed to help us whenever the light goes off and we are having surgery. So this light goes off when there is a lights out, and we have a standby one here which is supposed to help us. Unfortunately, immediately the light goes off, it also goes off. Then diatemy machine. It is used for cutting and also coagulating. Coagulating in the sense that it stops bleeding, but it is also not in good shape. So we will need a diatemy to help us in our surgeries. Then a locker to store our items here, together with instruments. This is the shape. So enough instruments to help us to carry out every procedure we do in the theater. So we are pleading. We don't have all the instruments for obs and gynae cases. Enough aprons. That's the anesthesia machine. It's been here for ages. So if you can get a current one, because it keeps going off and on. So if you can get a current one, and enough boots, aprons. See, these are the aprons that we are using. You mostly tie with a gauze. Okay. Yes. Yes. Scrub shoes. No, the scrub shoes are outside here. Then our operating lamp, a very important equipment in the theater. Operating bed, sorry. Very, very important. Sometimes when you operate and bring it up, it's difficult bringing it down. But you also have to bring it down for the patient to be able to climb and step on and sit on the bed. But unfortunately, sometimes when it goes up to the surgeon's level, it's unable to come down. And we find it very difficult to put the patient on the bed.
This is the two big plants that was installed when the hospital was built. And we installed this more than 20 years. It's about 23 years now. And they are not functional anymore. You can't do anything in the hospital, whether it's a surgery, whatever that you want to do. You cannot provide that kind of healthcare that you want to provide for the people. But we have just one CT scan, and that is just 250 kV. We go there from here, and that is what we've given to the emergency areas, like the emergency theater and maternity and those places. So as I said, this is the small one that is supporting us. This is the 250 kVA plant that we have given to the emergency areas. So for this one, it's very strong. Whenever there is a power outage, this is what we use for emergency theater, maternity.
Yeah, my name is Honorable Said Mubarak, MP for Sunyani, and a Member of Parliament for Sunyani East. Fortunately for us, this is a facility which finds itself in Manu constituency. And honestly, what we just observed today tells us that this hospital needs a lot of help. What even really broke my heart was the generator that they have here. If the national grid goes off, what they depends on is the generator. But unfortunately, it's faulty for some years now. We need a new one. We went to the theater, you could see that the place are not in a good shape at all. We need a lot of help. So you out there, we are pleading to you, come to our aid so that we can help our people have a better health care. And this is no more a regional hospital, it's a teaching hospital. We are lacking a lot of things, dialysis machine, mammogram, a lot of machine that we need here. So we are pleading to you that come to our aid that we can furnish the hospital. So thank you so much for your time.